big amount of bacteria.
Right. Now, Dr. Osama, let's say a lot of the people, like we were speaking before you joined us with Dr. Ibrahim al as well, and he's a consultant psychiatrist. But in general, I mean, we know that people have a fear of going to psychiatrists. There is a social dilemma with it. But even when it comes to doctors and health experts in general too. So let's say that somebody starts to feel that they are having the beginning of a urinary tract infection and they're feeling some of the things about it. Their mind could be in denial, oh yeah, maybe because I did not really drink enough water yesterday, and they're having the mild early onset of it, and they're thinking that just drinking water or keeping themselves more hydrated would solve the problem. Would it, or could it get more severe because they're delaying?
If you drink always, the water is not harmful. For the patient who is healthy initially, does not have congestive heart failure or renal failure or something, let's say, abnormal, if you drink enough amount of water or excessive amount, if you have good kidneys, you will excrete this excessive water without any troubles at all. So no problem by drinking excessive water if you are normal. And opposite of that, if you will drink less amount of water, you have a lot of troubles. One of them may be the urinary tract infection.
And that was what are some of the symptoms of the UTI? Because many people, I'm sure they go to you and like, I think I have this, I think I have that. They're not really sure about the actual symptoms. And I'm sure many of the patients, they come to you, they go home, they stay at home and then they research it, then they believe, oh, this is my symptoms, but don't read it completely. So can you please clarify for the viewers, what are some of the symptoms of UTI?
Yes. As a doctors, we, let's say, make the urinary tract infection two parts. One of them, we call it inferior urinary tract infection, inferior UTI, and the another is upper UTI, and there is difference between the symptoms, and also there is difference between the consequences after that. The lower UTI, this is something very common, and as we said before, it will affect the women more. The bacteria will reach the maximum, the bladder only, urethra and the bladder. The symptoms, the patient will come with urgency of urination, feel a lot of urgency that she will go to the bathroom, this is one. Burning sensation during urination, this is one. And when she tries to avoid the urine, the amount will be very, very less. So this is, for the women also, she will have pelvic pain. For the men, because the urethra will be, let's say, behind a little bit, the patient will come with the